The media is largely reporting that Rand Paul and Dr. Anthony Fauci sparred in a Senate committee hearing on the effectiveness of America's response to COVID-19. But it wasn't sparring. Anthony Fauci served Rand Paul a brutal mental beatdown for spreading misinformation and lying about statistics and data to fit his argument. Paul's embarrassingly ignorant line of questioning tried to paint Fauci's recommendation to physically separate as unnecessary because Sweden didn't do it and their death rate was lower than some states in the US. Dr. Fauci, though, quickly shuts this down.
To those who argue that the lockdown flattened the curve in New York and New Jersey, the evidence argues otherwise. New York and New Jersey wound up with the sharpest spike or highest death rate in the world at over 1,700 deaths per million. In contrast, Sweden had a relatively softer touch. Few mandates and mostly voluntary guidelines. Sweden's death rate ended up about a third that of New York and New Jersey. Some might argue that Sweden and New York and New Jersey are different populations, perhaps, but even the average death rate for the U.S. is now greater than Sweden. Do you have any second thoughts? Are you willing to look at the data that countries that did very little actually have a lower death rate than the United States?
You've compared us to Sweden, and there are a lot of differences. And you said, well, you know, there are a lot of differences between Sweden, but compare Sweden's death rate to other comparable Scandinavian countries. It's worse. So I don't think it's appropriate to compare Sweden with us.
Next up, Paul tries to argue that New York didn't flatten their curve by social distancing. They did so by exposing themselves to COVID, which in turn built up a herd immunity. Fauci again shuts this down.
New York had the highest death rate in the world. How could we possibly be jumping up and down and saying, oh, Governor Cuomo did a great job? He had the worst death rate in the world.
No, you misconstrued that, Senator, and you've done that repetitively in the past. They got hit very badly. They've made some mistakes. Right now, if you look at what's going on right now, the things that are going on in New York to get their test positivity 1% or less is because they are looking at the guidelines that we have put together from the task force of the 4 or 5 things of masks, social distancing, outdoors more than indoors, avoiding crowds, and washing hands.
Or they've developed enough community immunity that they're no longer having the pandemic because they have enough immunity in New York City to actually stop.
I challenge that, Senator, because I want to, please, sir, I would like to be able to do this because this happens with Senator Rand all the time. You were not listening to what the director of the CDC said, that in New York it's about 22%. If you believe 22% is herd immunity, I believe you're alone in that.
And finally, after being embarrassed twice already, Paul tries for a third time to stretch the truth, and Fauci shuts it down.
There's also the pre-existing immunity of those who have cross-reactivity, which is about a third of the public in many estimates from studies, which would actually get you to about 2/3.
I'd like to talk to you about that also, because there was a study that recently came out that pre-existing immunity to coronaviruses that are common cold do not cross-react with the COVID-19.
Thank you, Senator Paul. Senator Murphy.
For years to come, these clips will haunt Rand Paul as a senator who continues to proudly ignore the science regarding a virus that has killed more than 200,000 Americans. And while Fauci served him a warm plate of shut the hell up, Kentucky voters won't get the chance to serve the same plate of food to Rand Paul until his re-election in 2022. Thanks for watching. Be sure to like this video to help it spread, and subscribe to turn on notifications so you get my next video in your inbox. For Reflect, I'm Brendan Plank.